Yes,
Because
exactly.
with the HPV vaccine, it is oral cancer is associated because it is HPV virus, so anal warts, anal cancer, and oral cancers. Because 50% of the oral cancer in Western country is because of HPV. So between this, we are right now we are not including boys in our country, but then it should be given because I have decided I will give my boys the
Yes.
cervical cancer vaccine.
Yes,
So
yes,
HPV
absolutely.
vaccine.
Because I think, and I think, you know, the doctors on the panel must create awareness about it, that HPV can affect even boys. So it's not just women. Now, of course, men don't have a cervix, but then oral cancer, cancer of the anus, genital warts, all of these problems are caused by HPV. I would want Dr. Bhatt to, in fact, take that question. Just throw a little more light on HPV, since the awareness for around cervical cancer and the human papillomavirus is so important. Dr. Bhatt.
Now it has been 100% proved that cervical cancer is because of HPV. We were all these years doing pap smears. Now, pap smear, you may not get a lot of information, but anybody who has chronic cervicitis and who has been suffering from white discharge, we have switched over to HPV testing. So that is also very
Which
important.
is a DNA
When the
testing,
woman,
Dr. Bhatt?
yes, it is, yeah, it
It
is
is
a
a DNA.
cervical, yes, DNA testing of the cervix, which we send the smear to for his HPV testing. Once the patient comes positive, you have to treat her further with a biopsy and then, of course, a loop excision or whatever you want to do. But before that, please give her, if she is younger, in the younger age group, that is below 45 years, though they say that it should be at a very early age, at least for the benefit of doubt, you can give them cervical cancer vaccination and then, of course, treat her for the HPV infection.
Okay.
That is one aspect. And of course, now since so much of discussion is going on in the national media, I think the schools and the government schools and the college, that is the PU level, everybody should have awareness about HPV vaccine, and even the students can start taking HPV vaccine.
Okay.
That is at the age of from 12 onwards. I have a lot of queries which have come to me, especially in this cancer awareness month, that we have, should we take cervical cancer, and I encourage them. It has been included in the pediatric vaccination schedule also that HPV vaccine should be given to girls. Maybe in future, we should also think of vaccinating the boys.
That's
But
right.
at present, we have to vaccinate more and more girls so that this is 100% curbed, and we will have nobody in future succumb to this disease.
Well, absolutely. You know, the doctors have in fact put enough light on this disease, on what should be done, and I'm really grateful that we're having this discussion on HPV. You know, I'm going to give in the last words to Ravira. Ravira, what I want to ask you is this, that I was just thinking to myself, you know, that there have been extreme campaigns all over the world for various reasons. For example, PETA does some extreme campaigns. Climate activists do some extreme campaigns. This, in my opinion, is an extreme campaign in that sense. Do you in anywhere, you know, think that maybe we can, you know, sort of in a way forgive Poonam for doing this, at least for this time, and maybe genuinely she could have been interested in putting the spotlight on cervical cancer. And just give her the benefit of doubt for just some time. Ravira.
You know what? I think it's not an ethical campaign. That's what I'm trying to tell you, and that's what my opinion stands. Yes, she did, I think, somewhere spread awareness regarding it. But there are some ethics and morals that we follow in this world, and she has surpassed that with this campaign. Faking death is not a joke. It's not a prank.
Yes, yes.
And people losing. I lost my grandfather to cancer. People who lost people with cancer, for them, it's definitely not a joke. And there are n number of ways of spreading awareness. You know, like she could actually have gone to patients who have suffered through it or whatever it is. It would have been a much more positive campaign, and people would have loved her for that. But like faking your death with something that is it's actually a very sensitive kind of a cancer because of the taboo
Yes,
that
right.
a lot of female and over the years we have carried. But
Yes.
you can definitely spread this awareness in a much more positive and a better way.
Okay.
Yeah, she did bring up the chatter, but I feel it was not ethical.
She brought up the chatter, but then at the end of the day, she faked her death, her demise. I agree. Polio campaigns in the country have been beautiful, with just so many Bollywood stars talking about it. The shingles, for example, Mr. Bachchan speaks about it all the time. AIDS, in fact, HIV/AIDS in the past, in India and outside of India, have had some beautiful campaigns around the disease and breaking the stigma associated with many of these diseases. And I think that also could have been really a way forward for Poonam if she wanted to put this spotlight. This was going too far is generally the opinion of a lot of people. I'm going to thank all of you joining us for joining us here on the broadcast and putting out your perspectives there, and a doctor especially also for putting the spotlight on cervical cancer and the human papillomavirus.